our policy is that we do not fact-check politicians' speech, and the reason for that is that we believe that in a democracy, it is important that people can see for themselves what politicians are saying.
I'll turn it over.
Thank you. Thank you so much, Congressman. So we're here because we feel as though the American people have not heard from all the expertise that's out there all across our country. We do have some experts speaking, but there's lots and lots of experts across the country. So some of us decided to get together. We're America's frontline doctors. We're here only to help American patients and the American nation heal. We have a lot of information to share. Americans are riveted and captured by fear at the moment. We are not held down by the virus as much as we're being held down by the spider web of fear. That spider web is all around us, and it's constricting us, and it's draining the lifeblood of the American people, American society, and American economy. This does not make sense. COVID-19 is a virus that exists in essentially two phases. There's the early phase disease and there's the late phase disease. In the early phase, either before you get the virus or early when you've gotten the virus, if you've gotten the virus, there's treatment. That's what we're here to tell you. We're going to talk about that this afternoon. You can find it on America's Frontline Doctors. There's many other sites that are streaming it live on Facebook. But we implore you to hear this because this message has been silenced. There are many thousands of physicians who have been silenced from telling the American people the good news about the situation, that we can manage the virus carefully and intelligently, but we cannot live with this spider web of fear that's constricting our country. So we're going to hear now from various physicians. Some are going to talk to you about what the lockdown has done to young, to older, to businesses, to the economy, and how we can get ourselves out of the cycle of fear. Dr. Hamilton.
Thank you, Simone, and thank you all for being here today. I'm Dr. Bob Hamilton. I'm a pediatrician from Santa Monica, California. I've been in private practice there for 36 years. And today I have good news for you. The good news is that children, as a general rule, are taking this virus very, very well. Few are getting infected. Those who are getting infected are being hospitalized in low numbers. And fortunately, the mortality rate of children is about 1/5 of 1%. So kids are tolerating the infection very frequently. They're actually asymptomatic. I also want to say that children are not the drivers of this pandemic. People were worried about initially if children were going to actually be the ones to push the infection along. The very opposite is happening. Kids are tolerating it very well. They're not passing it on to their parents. They're not passing it on to their teachers. Dr. Mark Woolhouse from Scotland, who is a pediatric infectious disease specialist and epidemiologist, said the following. He said, there has not been one documented case of COVID being transferred from a student to a teacher in the world. I think that is important that all of us who are here today realize that our kids are not really the ones who are driving the infection. It is being driven by older individuals. And yes, we can send the kids back to school, I think, without fear. And this is the big issue right now, as Congressman Norman alluded to. This is the really important thing we need to do. We need to normalize the lives of our children. How do we do that? We do that by getting them back in the classroom. And the good news is they're not driving this infection at all. Yes, we can use security measures. Yes, we can be careful. I'm all for that. We all are. But I think the important thing is we need to not act out of fear. We need to act out of science. We need to do it. We need to get it done. Finally, the barrier, and I hate to say this, but the barrier to getting our kids back in school is not going to be the science. It's going to be the national unions, the teachers union, the National Education Association, other groups who are going to demand money. And listen, I think that it's fine to give people money for PPE and different things in the classroom, but some of their demands are really ridiculous. They're talking about, where I'm from in California, the UTLA, which is the United Teachers of Los Angeles, is demanding that we defund the police. What does that have to do with education? They're demanding that they stop or they shut all private charter schools, privately funded charter schools. These are the schools that are actually getting the kids educated. So clearly there are going to be barriers. The barriers will not be science. There will not be barriers for the sake of the children. It's going to be for the sake of the adults, the teachers and everybody else, and for the union. So that's where we need to focus our efforts and fight back. So thank you all for being here, and let's get our kids back in school.
Hello, I'm Dr. Stella Emanuel. I'm a primary care physician in Houston, Texas. You know, I actually went to medical school in West Africa, Nigeria, where I took care of malaria patients, treated them with hydroxychloroquine and stuff like that. So I'm actually used to these medications. I'm here because I have personally treated over 350 patients with COVID. Patients that have diabetes, patients that have high blood pressure, patients that have asthma, old people. I think my oldest patient is 92, 87-year-olds. And the result has been the same. I put them on hydroxychloroquine, I put them on zinc, I put them on Zitromax, and they are all well. For the past few months, I've taken care of over 350 patients. We've not lost one. Not a diabetic, not a somebody with high blood pressure, not somebody with asthma, not an old person. We've not lost one patient. And on top of that, I've put myself, my staff, and many doctors that I know on hydroxychloroquine for prevention, because by the very mechanism of action, it works early and as a prophylaxis. We see patients, 10 to 15 COVID patients every day. We give them breathing treatments. We only wear surgical masks. None of us has gotten sick. It works. So right now, I came here to Washington, D.C. to say, America, nobody needs to die. The study that made me start using hydroxychloroquine was a study that they did under the NIH in 2005. That say it works. Recently, I was doing some research about a patient that had hiccups, and I found out that they even did a recent study in the NIH, which is our National Institute, that is the National NIH, National Institute of Health. They actually had a study, and go look it up. Type hiccups and COVID, you will see it. They treated a patient that had hiccups with hydroxychloroquine, and it proved that COVID is a symptom of hiccups. It's a symptom of COVID. So if the NIH knows that treating the patient with hydroxychloroquine proves that hiccup is a symptom of COVID, then they definitely know that hydroxychloroquine works. I'm upset. Why I'm upset is that I see people that cannot breathe. I see parents walk in, I see diabetics sit in my office knowing that this is a death sentence and they can't breathe. And I hug them and I tell them it's going to be okay, you're going to live. And we treat them and they live. None has died. So if some fake science, some person sponsored by all these fake pharma companies comes out and say, oh, we've done studies and they found out that it doesn't work, I can tell you categorically it's fake science. I want to know who is sponsoring that study. I want to know who is behind it. Because there is no way I can treat 350 patients and counting and nobody is dead and they all did better. And then you're going to tell me that you treated 20 people, 40 people and it didn't work. I'm a true testimony. So I came here to Washington, D.C. to tell America, nobody needs to get sick. This virus has a cure. It is called hydroxychloroquine, zinc, and Zitromax. I know people want to talk about masks. Hello? You don't need masks. There is a cure. I know they don't want to open schools. No, you don't need people to be locked down. There is prevention and there is a cure. And let me tell you something. All you fake doctors out there that tell me, oh yeah, I want a double-blinded studies. I just tell you, quit sounding like a computer, double-blinded. I don't know whether your chips are malfunctioning, but I'm a real doctor. I have radiologists, we have plastic surgeons, we have neurosurgeons like Sanjay Gupta saying, oh yeah, it doesn't work and it causes heart disease. Let me ask you, Dr. Sanjay Gupta, hear me. Have you ever seen a COVID patient? Have you ever treated anybody with hydroxychloroquine and they died from heart disease? When you do, come and talk to me. Because I sit down in my clinic every day and I see these patients walk in every day, scared to death. I see people driving 2-3 hours to my clinic because some ER doctor is scared of the Texas board or they are scared of something and they will not prescribe medication to these people. I tell all of you doctors that are sitting down and watching Americans die, you're like the good Nazis, the good Germans that watched Jews get killed and you did not speak up. If they come after me, they threaten me. They've threatened to, I've gotten all kinds of threats. Oh, they're going to report me to the boards. I say, you know what, I don't care. I'm not going to let Americans die. And if this is the mountain, if this is the hill where I get nailed on, I will get nailed on it. I don't care. You can report me to the boards, you can kill me, you can do whatever, but I'm not going to let Americans die. And today I'm here to say it, that America, there is a cure for COVID. All this foolishness does not need to happen. There is a cure for COVID. There is a cure for COVID. It's called hydroxychloroquine, it's called zinc, it's called Zitromax. And it is time for the grassroots to wake up and say, no, we're not going to take this any longer. We're not going to die. Because let me tell you something. When somebody is dead, they are dead. They're not coming back tomorrow to have an argument. They're not coming back tomorrow to discuss the double-blinded study and the data. All of you doctors that are waiting for data, if 6 months down the line you actually found out that this data shows that this medication works, how about your patients that have died? You want a double-blinded study where people are dying? It's unethical. So, guys, we don't need to die. There is a cure for COVID.
Oh my God. Dr. Emmanuel, also known as Warrior. Before I introduce the next guest, I just want to say that I wish all doctors that are listening to this bring that kind of passion to their patients. And the study that Dr. Emmanuel was referring to is in virology, which talks about a SARS viral epidemic that affects the lungs that came from China. And they didn't know what would work. The study showed that chloroquine would work. It sounds exactly like it could have been written 3 months ago. But in fact, that study in virology, which was published by the NIH, the National Institute of Health, when Dr. Anthony Fauci was the director, again, the official publication of the NIH, virology, 15 years ago, showed that chloroquine, we use hydroxychloroquine, it's the same, a little safer, works. They proved this 15 years ago when we got this novel coronavirus, which is not that novel. It's 78% similar to the prior version, the COVID-1. Not surprisingly, it works. I'm now going to introduce our next speaker. Sorry, I forgot to say your name.
That's all right. Dr. Dan Erickson. Dr. Gold asked me to talk about the lockdowns, how effective they were, and do they cause anything non-financial? They always talk about the financial, but you have to realize that lockdowns, we haven't taken a $21 trillion economy and locked it down. So when you lock it down, it causes public health issues. Our suicide hotlines are up 600%. Our spousal abuse, different areas of alcoholism are all on the rise. These are public health problems from a financial lockdown. So we have to be clear on that fact that it's not like you just lock it down and have consequences to people's jobs. They also have consequences, health consequences at home. So we're talking about having a little more of a measured approach, a consistent approach. If we have another spike, coming in cold and flu season, let's do something that's sustainable. What's sustainable? Well, we can socially distance and wear some masks, but we can also open the schools and open businesses. So this measured approach I'm talking about isn't made up. It's going on in Sweden. And their deaths are about 564 per million. UK full lockdown, 600 deaths per million. So we're seeing that the lockdowns aren't decreasing significantly the amount of deaths per million. Some of their Nordic neighbors have less deaths for a variety of reasons I don't have time to go into today. So what my quick message here in a minute or two is just that we need to take an approach that's sustainable. A sustainable approach is slowing things down, opening up schools, opening up businesses, and then we can allow the people to have their independence and their personal responsibility to choose to wear masks and socially distance, as opposed to putting edicts on them, controlling them. Let's empower them with data and let them study what other countries have done and make their own decision. That's what I'd like to share. Thank you.
Are there any questions?
Are there any questions?
Who are you guys? We are so excited. Well, I'm from South Dakota.
You might have.
Yes. Yes. So
I'm so glad you guys are preaching this message.
you know, South Dakota did something interesting. It's interesting that you're from there. So the governor did not restrict access to hydroxychloroquine.
We know. We took
Right.
a lot of flack for that.
Right. And you were, I believe you were the only state in the union that did that. And there's been studies out there that attempt to show that it doesn't work. They're inaccurate because they're given at the wrong time, the wrong dose, the wrong patient, either too much or at the wrong time. So South Dakota did better because it had access to hydroxychloroquine. Thank you so much.
Okay, so if someone we love does get sick with COVID, and you said that the hydrochlor, whatever how you say it, is restricted, how do we get access to that?
That's the number one question we're all asked every day. I want you to know that you're not alone. I've had many congressmen ask me, how can I get it? So if the congressman can't get it, it's tough luck for the average American Joe getting it. It's very difficult. You have to overcome a few hurdles. Your doctor has to have read the science with a critical eye and have eliminated the junk science. Many studies have been retracted, as you know. And number two, the pharmacist has to not restrict it. Many states have empowered their pharmacists to not honor physician prescription. That's never happened before. That interference with the doctor-patient relationship, where the patient talks to the doctor honestly and the doctor answers the patient honestly, has been violated. So you have a very difficult time as the average American. Some of the information we'll share later this afternoon is to show the mortality rates in countries where it's not restricted and the mortality rates where it is restricted. So I have friends all over the world now because of this. And in Indonesia, you can just buy it over the counter. It's in the vitamin section. And I'm here to tell the American people that you can buy it over the counter in Iran because the leaders in Iran, the mullahs in Iran, think that they should have more freedom than Americans. I have a problem with that. My colleagues have problems with that. We don't like to watch patients die.
So, Dr. Bowman, if people have problems, they should be picking up the phone, and they should be calling their state and their federal representatives and senators and say, we are the American people, and we demand
Let me say one thing.
So you guys, we need the public to be
Right.
Thank you, Julie. That is exactly right. If you hear when you hear this, if you're concerned and wondering why you may not be able to get access to it, we need you to make 4 calls. Call your governor, call both of your senators, and call your congressman, and tell them that you want to know why you're not able to get access to a drug that doctors are telling you will help end this and help us reduce the number of hospitalizations and reduce the number of deaths. Urge them to read Dr. Harvey Rish's study from Yale. He's a Yale professor of epidemiology, and from there you'll find other studies.
Yes.
I wanted to ask, how do people trust the data that they're looking at every day? The numbers are so variable, whether you go to Johns Hopkins, CDC, which divides COVID deaths in different categories, whether it's related to pneumonia, other things. So how do we get the right information to make decisions?
So the only number that I think is worth paying any attention to, and even that number is not so helpful, but is mortality, because that's a hard and fast number. So the case number is almost irrelevant. And that's because there's a lot of inaccuracies with the testing. And also, even if the test is accurate, most people are asymptomatic or mildly symptomatic. So it's not that important to know. So the case number, which you see rising all the time in the news, is basically irrelevant. And if you had told us a few months ago that that was the number that the media was going to go crazy over, we all would have just laughed at that. I mean, that's essentially herd immunity. There's lots of people out there who have tested positive without symptoms or with very mild symptoms. So the only number that's worth paying attention to is mortality. When you look at the mortality, this is a disease that unfortunately kills our most frail members of society. People with multiple comorbid conditions, specifically diabetes, obesity is a big one. We don't talk about that, but it is. It's a fact. Coronary artery disease, severe coronary artery disease, people like that. And also, if you're older, it's a risk factor. But the biggest risk factor is if you have comorbid conditions. If you're young and healthy, you're going to recover. If you're under 60 with no comorbid conditions, it's less deadly than influenza. This seems to come as great news to Americans because this is not what you're being told. I would say the answer is it's very difficult to get accurate numbers.
If you, this is Matt Purdy of Breitbart News, if you had a message to Dr. Anthony Fauci, what would you say to him?
Listen to the doctors.
Listen
to the frontline doctors. Have a meeting with the frontline doctors. And maybe I need to say that into the microphone. My message to Dr. Anthony Fauci is to have a meeting with these frontline doctors who are seeing real patients. They're touching human skin. They're looking people in the eye. They're diagnosing them, and they're helping them beat the virus. They're the ones who are talking to the patients. Have meetings with them and do it every single day and find out what they are learning about the virus firsthand. And it's important to understand, we have doctors here who are not emergency room doctors. They're preventing patients from even hitting the emergency room. So if they're only listening to emergency room or ICU at the very tragic end of a person's life, they're not getting the full story. They need to come back and hear the earlier portion, and they also need to understand what the lockdowns and the fears are doing to patients around this country, because there are a lot of unintended consequences which the doctors can speak about.
Let me say something. My message to Dr. Anthony Fauci is, when is the last time you put a stethoscope on a patient? That when you start seeing patients, like we see on a daily basis, you will understand the frustration that we feel. And you need to start feeling for American people like we, the frontline doctors, feel. And you need to start realizing that they are listening to you. And if they are going to listen to you, you got to give them a message of hope. You got to give them a message that goes with what you already know, that hydroxychloroquine works.
I actually have a question for Dr. Warrior.
Dr. Emmanuel.
Dr. Emmanuel, you mentioned before some remarkable results that you've had treating your own patients. You said, I believe, over 300 patients.
Yes. Yes, sir.
Have you been able to publish your findings and the results from those patients?
We're working on publishing it right now. We're working on that. But this is what I'll say. People like doctors tell me all the time, publish the data. And my question is, and that will make you see patients? There's enough data around the world. Yes, my data will come out. When that comes out, that's great. But right now, people are dying. So my data is not important for you to see patients. I'm saying that to my colleagues out there that talk about data.
And if I can ask one more question.
May I just interject? There is a lot of
data out there
on this. Not every clinician needs to publish that data to be taken seriously. The media has not covered it. There is a ton. I've got a compendium on AmericasFrontlineDoctors.com. There is a compendium of all the studies that work with hydroxychloroquine. The mortality rate was published in Detroit less than a month. It was July 4th weekend they published it. Mortality by half in the critically ill patients. The patients who get it early, it's been estimated that 1/2 to 3/4 of those patients wouldn't be dead. We're talking 70,000 to 70 to 100,000 patients would still be alive if we had followed this policy. There's plenty of published data. I'm sorry
even
that
with
it's
Dr.
not
Rich.
out there.
Dr. Rich published data recently, so there's a lot of data out there. They don't need mine to make those decisions.
If I can ask one more question.
Yeah.
There was a little girl who just a few days ago was 9 years old, otherwise healthy, and it was reported that she died of COVID-19. So I was curious, from your perspective, do you feel that this little girl possibly died from some other condition that was wrongly attributed to COVID-19, or is there some other reason why she would have died from COVID-19?
I will not be able to say that till I look at the little girl's literature, the little girl's history and whatever happened. I know I've taken care of a lot of family members, and I see a lot of children, and they usually get mild symptoms, but I cannot talk about a case that I've not looked at.
Let me show you. What was the age of the child again?
She was 9 years old.
Okay. So listen, there are children who are dying of this infection. And the reality is that when they do die, they seem to have comorbidities. Really, you have to kind of look at each individual case uniquely. There have been a little over 30 patients in the entire country in the age category of 15 and below who have died of COVID. Frequently, they do have comorbidities like heart disease, they have asthma, they have other pulmonary issues. So I don't know. We don't know the answer to this 9-year-old girl, tragically. She passed and she's no longer with us. But there's probably, if you dig into it, there's probably a story behind it.
Dr. Hamilton, have you seen any patients who are having adverse side effects because schools have been closed with depression or suicide?
I mean, I think that it is common knowledge that with the schools not being open, when you think about your experience in junior high and high school, what do you think about? You think about parties and you think about football games, socializing. Those are the things we think about. Those are all being shut down, folks. Nobody's having fun anymore. And I will tell you that these are critical years of life to be out, mixing with other kids, other people, and that has been shut down. So yes, there are lots of comorbidities that go along with shutting down. We're talking about anxiety, we're talking about depression, loneliness, abuse is happening, and kids who have particular children who have special needs kids are not doing well either. So there is a long list of complications that occur when you quarantine and lock down people.